Hi, welcome everybody to this month's episode of Cronin's Corner. I'm State Senator John Cronin. Today I am pleased to be joined with my colleague in the legislature, Representative Michael Kushmerek, and Amy and Tara from the Labor and Delivery Unit at Leominster Hospital. So, today's episode is really about what's going on at Leominster Hospital, the proposed closure of the Labor and Delivery Unit, what we're doing as a community to respond, and really why it's so vital and important that we work together to try to keep this essential service open. So, ladies, I'm so grateful for you joining us today. One, I'm really grateful for the work that you do to serve our community and have done for a number of years. And I was born at Leominster Hospital. I think every family in Fitchburg or Leominster or the greater North Central area has a really deep personal connection to the work you guys do. And it's easy to tell people why it's so important to sustain the services that you provide every day. But to get us started, could you talk a little bit about what a day in the Labor and Delivery Unit is like, what your work is, and why it's so vital for our community?
Sure. We see moms.
And do you want to introduce yourself first? I'm
sure.
sorry.
My name's Amy Gagnon. I'm a labor and delivery nurse at Leominster Hospital. I've worked at the hospital, been a registered nurse for 16 years. I've worked at the hospital for 12 years on the Labor and Delivery Unit. That's the unit that the hospital is planning on closing. Our job right now is to see moms in the community, both prenatally and postnatally and during delivery. Just between Thursday night and Friday night, we had 4 moms that came in and delivered their babies within an hour of being on the unit. None of these moms would have had time to make it to Worcester.
My name is Tara Corey. I am also a nurse on the unit. I was actually 2 born at Leominster Hospital, and I gave birth to both of my children there. I transitioned to the unit about 3 years ago when I found out I was expecting my second, and I realized how much of an impact the unit nurses made on me becoming a mom, and I just decided that's what I wanted to do, and I wanted to leave an impact on the future moms and babies of this community. So this is just, it's heartbreaking. We see people from way out west past Athol and to Ashby, and we're serving more than just Leominster and Fitchburg, and this is something that cuts deep, and it's affecting a lot of people.
And I think one of the things that concerns us so much is the barriers so many people have to transportation.
Yes.
And so to have a centrally located labor and delivery unit here in North Worcester County is really critical to deliver care and keep people safe, right, and make sure they have access to prenatal and postnatal care. Can you talk about what that looks like on the ground in your work, and what concerns you about people having to travel an hour or longer to access services?
So right now there is currently a nationwide paramedic and EMT shortage. So we will definitely, if this closure goes through, have massive amounts of trouble with getting these mothers to UMass in time. A lot of the times a mother will come in and be ready to deliver, and there won't be time to put her on an ambulance and send her. The emergency room is going to end up doing the delivery with untrained staff, no equipment, nobody's trained.
Not sterile.
Yeah, not sterile. Nobody's trained in neonatal resuscitation. It's currently just a recommendation. It's not a requirement. And if you have a mom come in at 28 weeks ready to deliver, you're not going to have anybody there to help stabilize that baby.
And that's when you want some pros around.
Yeah,
that's when you want some pros. And we also have a lot of patients come in via taxi, or they're calling someone from their church because they're not actually even from this country and they don't have access to readily available transportation. So we get people of all different backgrounds coming in, and I don't know how someone would be able to wake someone up at 2 in the morning and have them drive them to Worcester at the drop of a hat. So it's scary.
I was discussing with my son's pediatrician the other day the real concern of not just the day of the big event of getting there for the delivery, but all the prenatal care that comes with it. And you spoke a little bit about your interactions with those expecting mothers. We're really concerned about the ability of ensuring that there's prenatal care and easy access to prenatal care and months 1 through 9 up until delivery. Can you talk a little bit about the impact that you're expecting to see through this closure of prenatal care?
Well, currently the offices are still planning on staying open, but they're planning on doing all their deliveries at UMass. And we do see a lot of problems if this goes through. If you have a mother come into the office and you hook her up to a monitor and she has a tracing that's not reactive, she needs to go to a unit right away. There's not time to put her in an ambulance and give her a 30-minute ride to Worcester.
And I think we do a lot of stress tests on the unit where a mother isn't feeling the baby move quite as much today, or was in a motor vehicle accident. They have to come to our unit and they have to be on our monitor, and they have to make sure everything's okay. So now that's a whole nother process. They're going to have to go to Worcester for that, rather than just coming upstairs from the emergency room or from the office. So that's another issue we're going to see prenatally, I think.
And I would think that you're going to see better outcomes when there's a continuity of care between prenatal, delivery, postnatal, right? And that's going to be disrupted.
Yeah.
And so your ability to interact as nurses with these patients, you'll be stationed in Worcester in the labor and delivery unit, so your ability to interact with the folks who will then be coming in, anywhere from 3 to 6 months later or 9 months later, you won't actually have that ability. They won't build that comfort with you, and you won't be able to really gauge expectations too.
Correct. Right now, our patients are coming in sometimes weekly for non-stress tests, so we get to meet them throughout the prenatal period, and then when they come in for their delivery, we already know them. We know the families. They feel comfortable with us. And then we'll continue to take care of them all the way through the postpartum period and assisting them with learning how to take care of a new baby and feeding the baby, so that continuity of care will be gone.
So I think, to all of us, this is really disappointing and really upsetting. The day before Memorial Day weekend, UMass Memorial and Dr. Eric Dixon, who is the CEO, filed a notice with the Department of Public Health announcing the decision to close this unit. As elected officials and policymakers, we hadn't been consulted. We didn't know this was something that was under consideration. I think what is most troubling is that we take being good partners with UMass Memorial really seriously, because we want outstanding health care and essential services to be delivered and be stable here in our community. And just in the past 2 years, the state and the state legislature has appropriated more than $85 million to stabilize UMass Memorial. $27 million to UMass in November of 2022, and more than $6 million to Health Alliance right here in Leominster. The explicit purpose of those funds was to stabilize and maintain essential services in disproportionately affected and economically disadvantaged areas like ours. And so we are looking into, were those funds spent the right way? And that is a process that we are taking on and that we are looking into in the legislature. But can you tell us more about when the process started that started the 120-day process? What is going on right now? And can you help kind of educate the public on what the next couple of months looks like?
Sure. The hospital gave a notice of closure of 120 days. At 90 days, they have to submit a formal report to DPH. At 60 days before the date of closure, we're going to have a public hearing with DPH. Nurses are going to testify, doctors are going to testify, patients are going to testify as to why we should be keeping this unit open.
So bringing a pregnancy to term, usually closer to about 270 days or so, right? And so what about all of the newly expecting parents who were planning to have their delivery at Leominster Hospital? What happened to them?
So, for instance, one of my cousins she's actually a nurse at the hospital, and she's due in October for her third baby. And her babies tend to come pretty quickly. So she had an appointment the Friday, the next morning after the closure announcement, and she was told, you can still see us for prenatal care, but you'll have to go to Worcester. And she was crying. She's like, I have to rethink everything. I've had my 2 other babies there, and now I have to change everything I thought was going to happen. And she's due, a week after the expected closure. So, and as mothers, that would have shook me to my core. pregnancy is hard enough. It's scary enough. Childbirth is scary enough. And the fact that you have to rethink everything you were planning to do, it's not fair. These moms were not given enough notice. That's not enough.
And you delivered one of your kids at Leominster.
Both of my kids,
right?
Yep.
To step back from this situation, could you both just tell us why you love your jobs and why you love working in the labor and delivery unit?
Yeah, sure. I love being able to assist new moms and new dads in supporting them through the birthing process, because it can be very scary.
And I think a big part of it for me is I love educating, and I love when the first-time parents are asking all of the questions, and they're like, I know this is a silly question, and it's like, no, it's not. It's important, and you don't know. And I love that I can leave an impact on your life and on how you're raising your child. And I think that is so rewarding for us as nurses to know just how many families we've touched in this community. And it's such a rewarding job. We're so lucky. We're at the beginning of life. Yes, there's always some bad things that can happen, but it's so nice to be a nurse.
But you're there for that too, right?
Yeah, right, and we are. And we're trained to be there for that, and we know how to handle that, as opposed to maybe someone on a different, in the emergency room or in the ambulance wouldn't know. So it's rough.
So I think there's been an incredible outpouring of support from the community, and everybody. It's important to everybody to keep the labor and delivery unit open, because we know once we lose it, we're never going to get it back.
Right.
What has that outpouring of support from the community meant to you, and what can people do to help change UMass Memorial's mind? Because Dr. Eric Dixon can rescind this closure and keep this
So we're asking all of the community to call Dr. Eric Dixon and ask that this closure be stopped.
We had started a Facebook page called Leave Labor in Leominster. We started it Sunday night, and we've had, it says we've reached 16,000 people already.
Yep.
The greatest part of this is we are getting stories of when people delivered their babies, how they're so thankful for our unit. I've had people that delivered about 30 years ago commenting, saying, I delivered within a few minutes of being on the floor. My baby was blue. The cord was around his neck, and here he is because of you. Yeah. And it's just so touching for us, and it's powerful that everyone is in support of us. And we are so thankful. I think the rally that you had hosted for us the following week was amazing. Yeah. It gave us the inspiration we needed to start this fight. And we're hoping to keep the momentum up and keep going with it.
And so you guys are coming to the State House to see us. And I know we are planning on, I think one of the things that we are proud of in North Central is, we mess with each other, but nobody really messes with us.
Right.
And as a delegation, we're going to have a united front testifying on legislation that would prevent things like this from happening in the future. But can you talk about, what your message is going to be testifying at the State House, and what you hope that other leaders can hear who aren't affected by this or around the state?
So what my message is going to be is that basically everything is a blind promise. When they closed our pediatric unit, the hospital had promised they would create a pediatric observation unit in the emergency room for children to be seen as a promise to allow the closure to go through. That was never followed through. Nobody ever followed up on it. The hospital didn't get penalized in any way. So we feel when we do go to DPH, they're going to tell us right away, this is an essential service, and it needs to stay open for the community. But right now, the hospital can basically do whatever they want unless we get this bill passed. We need to get this bill passed. There needs to be more power in DPH to be overseeing what is happening inside these hospitals.
Yeah.
Well, and that process has played out too before, and we know it all too well. And in Fitchburg, we had a whole hospital and an entire complex with in and outpatient services at Burbank. And in the midst of a mental health crisis, they closed a mental health unit. When we knew there was a distinct lack of beds, they closed a service that was desperately needed by the community. DPH ruled the service to be essential, and they closed it anyways. And we saw that repeatedly throughout Fitchburg, to the point where Burbank's campus closed. Clinton Hospital has repeatedly lost services, and just 2 years ago we saw it with cardiopulmonary and pediatrics at Leominster. So we've seen repeatedly that the service as it's the process as it is currently situated doesn't actually result in stopping those closures.
Right. It doesn't, and that is the thing I think was so surprising to us. Because when we learned of this, we're like, okay, we're gonna do something to stop this, but there's really not much we can do. DPH is going to say we need the service, and they can't stop it. So my testimony at the State House is going to be, we need to change the course of healthcare in Massachusetts. It needs to change because this is going to keep happening. We've seen it multiple times in our little hospital in the short time we've been nurses, and we just need to change the future for everyone.
And I think it's so harmful to us as a region. I mean, the trend is really consolidation, and the trend is losing essential services one by one, tick by tick, from North County and North Central to Worcester. And you know, everybody says they believe in health equity, but you know, health equity means public payers, Medicare, Medicaid, Mass Health patients deserve access to the same essential services here that they do in Worcester, or that they do in Boston. And so I think it's disheartening. It's really troubling for all of us to see that continued loss of services.
Well, there's a real expectation, I think, from your community hospital, right? A nonprofit organization, to a commitment to the entirety of the community.
The whole community, exactly.
And then we know that down the street from this very studio, you know, whether it's on Elm Street or High Street or down in Clegon and Fitchburg, there are single mothers with 2 or 3 kids expecting their next child and trying to figure out, without a car, it's already been difficult to get to Leominster. How do I get to Worcester? And what happens if I need that prenatal care along the way in Worcester and not in Leominster?
Right, correct.
And it's just not going to happen.
It's not going to happen.
The mothers will make the decision.
They won't be getting prenatal care.
And that's going to lead to some pretty sad outcomes.
So what are some of the risks for not having access to prenatal services? Or?
Well, I mean, to not having access to prenatal visits can catch so many different problems that can be helped ahead of delivery of your baby. High blood pressure, different things on the anatomy scan that might be wrong with the baby, so that when the day comes of childbirth, you're prepared. You know what's going to happen. There's some sort of preparation no matter what. And that, I mean, if you're not getting prenatal care, a lot of those things that could be prevented are not going to be prevented
anymore. And a lot
of
these high-risk patients that we pick up on their prenatal visits will follow them closer throughout their pregnancy. And these folks aren't going to have access to that if the unit gets closed.
So earlier we mentioned Dr. Dixon and his ability to overturn this with the snap of a finger. You know, I find it so incredibly disingenuous that 30 days in, just for the first time, he's reaching out to, you know, the political leadership. Never was there an indication, is my understanding, in conversations with the Massachusetts Nurses Association and with your union and with your unit. Yet, there's been some indications all along, right, that this is the direction they wanted to move in.
Yes, correct. They've been purposely withholding jobs for probably over a year. I've been fighting with my manager to get my nurses on postpartum cross-trained, and they just have blatantly shut me down every single time. I managed to get one nurse trained. Had I managed to get everybody trained, we would be fully up and running, and we wouldn't be relying on any agency nurses.
And aside from the staffing issue, they're claiming lower birth rates. So one of the things
But our communities are growing here in Fitchburg and Leominster.
And we had started a while ago recognizing our lack of marketing for our unit. And we were trying to do things such as bring in new ideas. UMass is big on a innovation board where they want the staff to be putting ideas up. And I am the one that runs our innovation board, and I was told by one of the people in that department that we have one of the most engaged idea innovation boards throughout the whole system. And I had myself written for a grant proposal to get queen-size postpartum beds in for our patients, because that is something that would draw people in. It's different, and I got the grant approved a year ago, and I have been fighting to get those beds ordered and get that going, because that would be something we could market. And it just never, I was fighting with, I mean, we've had multiple managers since then, but it just never came to fruition. And it's really hard for us that have been working so hard, because we knew there was a problem. We wanted to bring in more people to our hospital. And we have tried and tried and tried, and there's just always been someone up there not letting things happen.
And those are the two things that we've been told. There's been serious workforce challenges and declining births in the hospital. But I think, you know, both of those things we can be a little bit skeptical of.
Anything that they're telling you has been orchestrated by them.
Right.
And yes, I would say birth numbers have gone down, like you said, but we're still busy.
There's a lot of births for people who live in North Central who are within the UMass system but are going to Worcester.
Right. And we could,
and that wasn't always the case, right?
Right.
There were more people, and frankly, it's more affluent people in our community who can go down to Worcester.
Right.
And you mentioned there's been a seismic shift in the number of births
Yes,
at
correct.
Leominster Hospital from when you started to now. Can you talk a little bit about that?
So probably about 6 years ago, we were doing over 1,000 deliveries a year. And then about 5 years ago, we dropped down to about 100 deliveries a year. So I investigated a little bit, talked with the different patients, and they were being told that their insurance is no longer accepted at our hospital. They are now being told that they have to go and they have to deliver at St. V's. And a lot of these patients are Medicaid patients.
I just want to say we've never been down to 100 a year, right?
500. I'm sorry,
Right,
500.
yeah.
Oh, that would be
we went
low.
from 1,000 down to 500. So we're currently doing about 500, a little bit over 500 a year. But at the time, we were doing 1,000.
But that's still a significant amount. I mean, there's days, last weekend there was 8 new babies on our unit. I mean, that's pretty significant.
Right. Absolutely. And it's a major population center here in the state.
Well, and you think of new families that, you know, whether they're aspiring new families and they're thinking about starting a family in the next couple of years, or those that are, you know, continually growing the size of their family. They think about two things, right? They think about the quality of education, and they think about the quality of health care in their backyard. Of where can I deliver, and how quickly can I get to the hospital to ensure that my child has access to health care. And they're taking one of those things away, right?
Yeah, absolutely.
And it speaks to a larger issue in the healthcare system, is that, you know, healthcare delivery is heavily publicly subsidized by taxpayers through Medicaid, through Medicare, through our mass health system, through things like, you know, we passed $350 million last November in our economic development package to stabilize services. And so I think it's like we are watching the system break in front of us, that taxpayers are stabilizing these essential services, but also that government has no mechanism to really hold these organizations accountable to deliver those services and to lean into health equity and make sure that disadvantaged areas of the state have access to things like maternal health care at a time when across the country we're moving in the wrong direction for maternal health. Could you speak kind of you know, outside of North Central, but across the country, what, you know, some of the challenges to maternal health that we're facing?
This is not only a problem in Leominster, this is a problem across all of the United States. We're seeing hospitals shut down labor and delivery and psych units because of low Medicare reimbursement. I mean, Medicaid reimbursement would be mass health for us. We feel that's why we're purposely being targeted. A lot of the population that we see is
poor people,
low income, and minorities, and we feel like this is why this is happening to us. If it was elsewhere, you wouldn't be seeing this happen. These patients are now being told they have to go and deliver at UMass. They want to try and get them to be all under one unit because the reimbursement rate they're receiving at Leominster is low. It's probably about $6,000 from soup to nuts for the whole delivery, whereas if somebody came in with Blue Cross Blue Shield, it would be like $15,000 to $25,000 of reimbursement. So their plan is really to funnel all these patients onto one unit, and they have the high cost of the NICU to offset the low cost of the mass health patients.
And our nurse association had posted recently a map of Massachusetts, and it kind of shows the maternity deserts. And North Central Mass is in the red, and it's scary. You see the North Shore in the Boston area, it's all looking good in the blue, and then you see us, and I mean, it scares us as moms, as nurses, and that's just not the direction we should be heading. It's 2023. Let's move forward in healthcare, not backwards.
I think one of the things that our colleague Representative Kilcoyne says that is, I think, pretty poignant is, you know, I'm going to have less access to maternal health care than my mother did.
Yeah,
that was like the most shocking thing when I heard her say that.
Yeah, that was so powerful.
Yeah, it's, how is this even happening? Like, you can't even believe this is real.
Right. So there's been an incredible outpouring of support from the community. I think everybody has reminded about how vital your work is and how important it is to keep this essential service in North Central Massachusetts, here in Leominster. For the people watching at home, what can our community do? What do we need people in our community to do over the next 2 or 3 months to try to stop this and to support you?
Yeah, so we need people of the community to reach out to Eric Dixon and tell him to stop this closure, because he has full power on doing that. We would also like people to sign your petition. We've started a Facebook page and we've tagged it to the top there. And we have QR codes that we're going to be distributing throughout the community to restaurants, doctors' offices. When people see them, just scan that QR code and you can sign the petition, because we need to get this bill passed.
And we need, watching our Facebook page, we'll be sure to post all the media coverage of this to keep people updated regarding the hearing. There's also a link on there if people want to get involved in different events we have coming. They can sign up that way.
And so to Dr. Dixon, who has yet to engage the delegation, the municipal leaders like the mayors of Fitchburg and Leominster and the town managers of the surrounding communities, has yet to engage the nurses union. What is your message to the CEO of UMass Memorial Healthcare?
He needs to come to the table with you guys and start a discussion.
And he needs to come to our unit. Come see what we do. Come see who we're serving. I mean, even the upper management within Health Alliance, I don't believe they've even come. I mean, the way we were told about the closure was just kind of a,
we found out from another hospital, from our friends.
Over text message, right? Yeah.
And then, so it's just, no one's really come to the table for anyone.
And I think it's a really reasonable ask to say, come tell us what you need to stay open, right? We just got the UMass Memorial System $33 million less than 6 months ago.
And every other hospital in the region that has needed help, they've engaged us. They've asked us, please, what can you do? They've engaged the federal partners, the state partners, and the local ones to ask for resources and for help.
And none of that has happened yet.
And none of that happened.
Yeah. So you can find the petition on my Facebook, on the Leave Labor and Delivery Facebook page.
Councillor Sally Cragen is also circulating printed petitions too, so if you don't have access, you can contact Councillor Cragen in Fitchburg as well.
And what else are we going to be doing at the State House moving forward, Mike? Yeah,
so every possible opportunity, we're going to be ensuring that our colleagues in the legislature, whether they're in Provincetown or North Adams, know about this, but also more importantly know about the proposed legislation that we're pushing to really ensure that essential services determinations and closures cannot move forward, and that the Department of Public Health has really serious teeth to be able to stop these and to force hospital and healthcare organizations back to the table to ensure that these services are not lost in communities like ours.
So we've got about a minute left, and I want to give you both kind of the final word here. So what's at stake, and why is it so important that we keep this essential service open in the region, and what do you need from everybody in the community?
Lives are at stake, a lot of lives. I think that's why I'm most scared. It's scary, babies' lives and mothers' lives. How about you, Amy?
Yeah, I agree. Same thing. Lives are at stake. You know what I mean? We won't have the safety net in place that we have right now to deliver people that their baby would need emergency resuscitation. There's not going to be any skilled personnel available in the hospital. If somebody should come into the emergency room by ambulance, it's going to be frightening. We want to make sure that personnel is there and that everybody's trained and ready to go.
So we just really want everyone to share your story, share your support, show up to our hearing. It should be around the end of July.
We're going to have more rallies planned.
More rallies.
There will be an essential services hearing.
We're going to fill up the bus on the 20th with M&A nurses and doctors.
And community members.
And we're all going to be at the State House in support of this bill.
Great. Well, I want to thank you both so much, not just for the work you do every day for our community and the families that you serve and the young mothers and children, but for your advocacy here and really the courage to speak up and share what's going on the ground, because this is so important for us.
And, it is. And thank you. Thank you for having us. This is great. We're glad that people are open to listening and willing to fight with us.
And the fight goes on. So
It does.
that's it for this month, everybody. Again, please look at our Facebook page, follow the nurses page, and get involved. We need your support to keep labor and delivery open in Fitchburg and Leominster and the North County.